Hello, good morning. Myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department in RPIIT, Technical and Medical Campus, Karnal. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we will discuss about the radial nerve anatomy and its clinical implications. So anatomy of radial nerve. So the radial nerve is the continuation of the posterior cord of the brachial plexus. It is the largest nerve of the brachial plexus and it supplies the posterior, that is extensor compartment of the upper limb. It carries fiber from all the root, that is C5, C6, C7, C8 and T1 of brachial plexus. So this figure represents the various roots, trunk, division, codes of the brachial plexus. So brachial plexus consists of 5 roots, that is C5, C6, C7, C8 and T1. Then have trunks, division and core. And then at ending they have 5 nerve, which is radial, musculocutaneous, median, ulnar and axillary. So next is the radial nerve course in axilla. So the radial nerve lies posterior to the 2/3 of the axillary artery and anterior to the muscles forming the posterior wall of the axilla. And here it gives the 3 branches, that is posterior cutaneous nerve of arm, nerve to the long head of triceps, nerve to the medial head of triceps. Next is course in the arm. So radial nerve enters the arm at the lower border of the teres major and it passes between the long and medial head of the triceps to enter the lower triangular space through which reaches the spiral groove along with the profunda brachii artery. So this figure also represents the course of the radial nerve. Next is the branches in the spiral groove. So in spiral groove, radial nerve gives the 5 branches, that is first is lower cutaneous nerve of arm, second is posterior cutaneous nerve of forearm, third is nerve to lateral head of triceps, fourth is nerve to medial head of triceps, fifth is nerve to anconeus, that is it runs through the substance of medial head of triceps to reach the anconeus. And at the lower third of the humerus, it pierces the lateral intermuscular septum to enter anterior part of the arm, and it lies between the brachialis mediali and brachioradialis and external carpi radialis longus laterally. Next is the course in the forearm. So to enter the forearm, the radial nerves move anteriorly over the lateral epicondyle of the humerus. And in the cubital fossa, it terminates into 2 branches, that is superficial branch and the deep branch. Superficial branch is mainly kind of a sensory and deep branch is motor, also called as posterior interosseous nerve. So this is a course of the radial nerve in the forearm, where it divided into 2 branches, that is deep radial and the superficial radial. And there is no cutaneous nerve of the peripheral nerve and area unequally innervated by the superficial radial nerve, that is area around the nerve box. Thank you.